I'm going to start off with question number 1. It asks, what skills identified in Chapter 7 and in the Leadership Skills Questionnaire would you use to secure needed resources, such as staff? First off, after completing the Leadership Skills Questionnaire, I scored the highest for conceptual skill, and I agree with the score. I agree with the score of being the highest for conceptual skill, as I do see an organization as a whole. More importantly, I see an organization as a team effort, working together for the same goal, which is patient safety and satisfaction. According to Accounting Details, quote, conceptual skills are the skills a manager must have to think and to conceptualize about abstract and complex situations. By using these skills, managers must be able to see the organization as a whole, understand the relationships among various subunits, and visualize how the organization fits into its broader environment, unquote. I would have to say that in Chapter 7, starting on page 153 to 156, I would use the skills depicted such as planning in advance for adequate staffing, organizing, ensuring adequate staff that is required to provide for patient care, coordinating and directing staff, and lastly, controlling activities according to the issue, and in this case, appropriate staff. I will need all planning, organizing, ensuring adequate staff, coordinating and directing, and controlling as a manager to provide enough resources such as staff. Question 2. How would you use published literature in the process? I chose the article, quote, Transdisciplinary Coordination in Delivery of Care, unquote. The article talks about the need to increase new strategies for transdisciplinary care through education, research, and clinical practice. The article also states by implementing transdisciplinary care that, quote, perhaps the patient's perception of care would be enhanced if all caregivers consistently demonstrated substantially similar behaviors of professionalism, caring, compassion, commitment, and effective communication through the patient's continuum of care, unquote. I feel that this would be beneficial not only for the patient's health, but also for the healthcare system. Question 3. Identify the levels and departments that you would need to work with in order to be effective in your role. I received my organization model for my workplace from administration, and it is vertically structured. When looking at the model, to be effective in my role, I would have to work in conjunction with every level and department to be effective as a manager. I would need to work with our director, house supervisor, and senior VP Patient Care Services /CNO. Question 4. Explain if you feel you would have a preference for a vertical or horizontal structure in a particular model and why. At our unit, we have a vertical structure, and I feel that it works well for our small unit. I feel that a vertical structure is well defined as to where your chain of command is, and because everyone has a specific area and responsibility. As to my hospital model of care, it is recently being revised, and the revised model of care is relationship-based care, which promotes total cultural transformation. This model encourages teamwork based on a deep commitment rather than surface level of compliance. And I've only been at my job for only 6 months, and this new model of care is basically on the verge of just coming out and implementing into the whole hospital. So I really wouldn't know if this model would work or not, but just looking at it and noticing that it's relationship-based care and it promotes total cultural transformation and it's centered towards the patient, I don't see why I wouldn't like it.